Good afternoon, everyone. It's Dr. McQuillan from Berkshire Menopause Clinic. So we are on part 2 of our endometriosis series, and this time we are talking about management. So like everything I say, it is all about individualizing care and you and your specific story. When we look at treatments of endometriosis, we are looking at a plethora of things. Firstly, we are looking at symptom control and quality of life. How's it affecting you? Because how it affects you will affect someone very differently, and therefore how we use treatments are going to be different from person to person. So quality of life and treating your symptoms is absolutely important. The other thing is we're looking at how we can prevent symptoms from getting worse. What treatments can we use for that? Then we are looking at whether or not fertility is an issue. So are you undergoing investigation or treatments for endometriosis because of fertility problems, or could this be something that could potentially become a problem and we want to prevent that from happening in the first place? Okay, so these are the things that we're looking at when we look at treatments. So let's just talk about all the different types of treatments. The aims of the treatments are to reduce the endometriosis symptoms and reduce inflammation as well. So from part 1, just to give a very quick overview, you would have remembered me saying that so endometriosis is having womb-like, so womb endometrium deposits anywhere else in the body. It could be in other layers of the womb, it could be in the ovaries, it could be in other places like your cervix, your vagina, anywhere in the pelvis and around the bowel bladder, or even further away like the lung, okay? Why it happens is because of a flare-up of estrogen. And when that happens, then when the womb lining eventually sheds, like here, then we can get symptoms such as heavy, painful periods. But if there are other deposits in other parts of the body, we will get all those other symptoms as well. Now, why do we aim to reduce the endometriosis, or we're trying to basically stop ovulation, is because it's triggered by estrogen. So if we can reduce that, then we can either shrink or reduce those endometrial deposits from being flared up. The other treatment we want is to try and reduce inflammation, because for some people, and many people in fact, it doesn't just become that cyclical symptoms. You can get symptoms outside of your period, because eventually that constant trauma on the body of bleeding of those different deposits leads to inflammation and scar tissue and eventually chronic pain. So we want to reduce that inflammation as well as try and reduce endometrial deposits or ovulation or estrogen. Okay, so how do we do that? So I really believe we approach everything, okay, not just medicine. So if we think about lifestyle for a point of view, many people do find that reducing the inflammation in their body can help reduce endometriosis, because it's often thought of as an inflammatory condition. So this could be things like following an anti-inflammatory diet. This could be things like looking at your mood and things that can worsen stress and cortisol in the body. So looking at things like meditation, looking at things like cognitive behavioral therapy. And then of course, what are other things that can trigger inflammation in the body? Reducing alcohol, reducing or stopping smoking, and looking at things like exercise. Now, all of this should be individualized to you. So this is very much depending on your lifestyle, depending on what ability you have to do those things. But, you know, every little thing does help. So I often say keep a diary, not only of your symptoms, but what things could be helping as well. What foods or drinks or lifestyle practices trigger your symptoms and what things make it better. So that's one aspect. Then we have non-hormonal medications, okay? So we said about reducing inflammation. So you can get anti-inflammatories. Again, very much individualized on whether you have medical conditions and whether you can have anti-inflammatories and actually where you are in your journey. But anti-inflammatory, so for example, as simple as ibuprofen, and don't forget simple pain relief like paracetamol, that can help. But then we can look to more further anti-inflammatories like mefenamic acid, tranexamic acid as well. So they not only help with the inflammation, but can help reduce heavy periods as well. Not everybody wants hormonal treatments, and not everybody can have hormonal treatments, so they may be a really good option. Then we look at hormonal treatments. So what is the aim of hormonal treatments? As I've just run through, by reducing that estrogen effect, we reduce ovulation, we reduce either the deposits even forming in the first place, reduce them flaring up, or we try and just stop the periods to try and stop that cycle happening. Okay, so what about different forms of hormonal treatments? This is where it depends on fertility. If fertility is your priority, then obviously that limits in terms of what we can have. And hormonal treatments often have to be put on the back burner till you have your children, because they will often reduce ovulation and stop you getting pregnant. So that's why it's really important we have that discussion and try and individualize care. So in terms of what we can use for hormones, we can use contraceptive pills. So the combined contraceptive pill, the progestogen-only pill, the contraceptive implant, the injection, the progestogen-only injection, and coils. So things like the Mirena coil or Levocert or Benelixa. These are high-dose progestogen, localized progesterones that not only try and reduce bleeding, they reduce pain, and often in many women can stop periods as well. Okay, there is also another type of synthetic hormone called dienogest. This is a synthetic testosterone derivative that has a progestogen effect on the womb. It reduces estrogen and tries to reduce those endometrial deposits as well. So that's another form of hormonal oral treatment. Then we have our GnRHs, our gonadotrophin releasing hormones, okay? So what these do, they try and suppress, so this is our brain, and it tries to suppress the precursors to our gonadotrophin. So like our hormones, our estrogen, progesterone, testosterone, what it does is it sends signal from the brain, increasing those levels, and then it tells, basically the brain is telling our body, you've got lots and lots of estrogen, progesterone, we don't need anymore. So then a negative feedback is sent back to eventually stop those being produced. So then we're reducing that estrogen and that ovulation again. Now, traditionally, these have come in injectables. You may have already been using them. And they switch off the ovaries effectively. They're a medical form of menopause. So obviously what that can do is it can increase menopause symptoms. It can also affect your bone mineral density. So it's really important, if we're giving them, that if you're having it for longer than 6 months, then we are protecting both your bones, but we are also giving you HRT alongside that, or a form of HRT, because of the menopause symptoms, okay? And because of the effect on the bones. However, there have been some newer treatments, one brand names in particular called Relugolix and Linzagolix. Linzagolix is GnRH antagonist on its own. Relugolix is combined with northestrone and estradiol to try and almost effectively give that HRT in the same tablet, so you're not needing extra add back HRT. But these are oral tablets, so it gives you a bit more autonomy. They're not invasive with injectables. You can give them for longer, because often if given in your GP surgery, we don't give them for longer to 6 months to 2 years. So it's another option for patients, which is really good. Then, of course, we have operations. So this could be to remove endometrial deposits in the first place, remove scar tissue. And the reason for your operation may be to reduce your symptoms, so reducing the pain. It may also be to help with fertility, so to try and open up your tubes if there's any scar tissue around, and reducing the endometrial deposits or any cysts that might be causing you symptoms, or any fertility treatments as well. So that's reducing all of the actual endometriosis. You may have surgery to also take away the womb lining if you're getting really heavy periods, if that's the reason of your symptoms. And of course, then you may have further treatments, for example, taking away the ovaries. So that is a surgical menopause. By doing that, you're reducing, obviously, your estrogen and stopping you ovulating. And the aim of that is obviously to try and shrink and get rid of the endometrial deposits, or stop any further deposits from forming. And with that, some people, if they get heavy periods alongside that, or if they don't need their womb anymore, may have the womb and the ovaries totally removed. Now, that is a lot of treatments, right? So it has to be really individualized, and it has to really depend on whether fertility is still an option for you, what your symptoms are individually, and your quality of life, and what option's best for you. And it's important that all of these are explained to you. So I hope that was a helpful run through of all the different type of treatment options.